Are you suffering from pain in your hand which doesn't seem to go away? Do you experience pins and needles or tingling sensations in your first 3 fingers or even on the back of your hand? Well, you could have something known as carpal tunnel syndrome, a very common cause of hand injury in today's society. So usually, just to give you a rundown about carpal tunnel syndrome. So this is overall common in a lot of people who use their hands a lot, especially hairdressers, butchers, or anyone else who do a lot of typing or office jobs. So what carpal tunnel syndrome is actually an inflammation of your median nerve in your tunnel of your wrist right here. So in your wrist, you have a lot of the forearm flexors that come through and actually flex and bend your fingers. And right in that tunnel, the nerve also comes through and supplies those muscles. It's like the powerhouse of those muscles and causes them to move. The nerve also provides sensation to the first 3 fingers, and that's why when you feel the pins and needles and numbness, it's coming from the nerve that's irritating your sensation. Okay. So what can we do for carpal tunnel syndrome? Well, physiotherapists like myself and the team here at New Age Austral have designed specialised treatments to help you with managing not only your pain, but trying to help flush your nerve and glide it in order to help you reduce these symptoms. Now, usually there's a common misconception where people think that they need the carpal tunnel release surgery to obviously reduce these symptoms. Well, according to obviously recent studies and evidence, it shows that having 6 weeks of physiotherapy compared to having the surgery actually leads to the same outcomes. So if you're having carpal tunnel symptoms, it's best to try physiotherapy, rehabilitation, exercises, and conservative treatment before going through and going under the knife, which is something you want to try and avoid. So in this video, I'm going to show you guys a very good nerve glide, which is very, very effective in helping with trying to reduce these kind of symptoms with your carpal tunnel syndrome. So, very easy to do. So essentially this exercise starts off with you standing nice and upright, and you're going to keep your elbow tucked in and pretending that you're holding a plate onto your hand. And then essentially what you're going to do is you're going to straighten your elbow and move your head to the same side, and then straighten back up, and then floss the nerve to the other side. So essentially, repetitions and sets, you can do 3 lots of 20 of these, and you can do them 2 times a day. So if you're suffering from carpal tunnel syndrome, or any of the things that I've just mentioned here, it would be best to come in here at New Age Physiotherapy, Austral, to get your professional diagnosis, to get your recommended treatment plan, and to help you relieving from your symptoms, and get back to your everyday activities so that you obviously find it a lot easier to work and be pain-free. So give us a call here at Austral at 9606 8258 to start your plan. Thanks, guys.